Welcome to everyone. I know we've got folks that are still connecting and coming in from the waiting room, so we'll wait. We'll get started while our group is still assembling. But it's so great to see everybody, at least two-dimensionally. I think we're coming very quickly on the time where we're going to get to see each other in 3 dimensions. We don't have to just run into each other, Don Thompson, like you and I did last week. We can actually be together in person, and then at some point, we hope in the not too distant future, we can actually be in groups together in rooms, and that is going to be a beautiful day. But we're going to start today, and we're going to warmly embrace the fact that at least we get to be together on Zoom for this this time together today. And I know that we have all been thinking of very little else over the past year than how the pandemic has affected our community, how all of you in your various roles have stepped in to respond. So we're going to bring some fresh perspectives to this constant deliberation we're all in today, and hear from community leaders and have some reflections on some of the work that we've been engaged in with donors that partner with OCCF. So welcome. And right as we're getting started, I want to say just a word of housekeeping. I know we have our Zoom PhDs now, almost, right? From those of us who came kicking and screaming to Zoom, that was me. But it's now, we have made it our friend. So you'll all see the chat button at the bottom of your screen. And because we have a large group today, we're going to ask people to stay on mute. Love for you, anyone who's comfortable, to be on camera so we can see faces. But if you've got questions, please put those in the chat. We've got folks that are monitoring, and we'll pull as many of those as possible into the conversation today. And anything we can't address, we will follow up with. So we'll be capturing all that. And please feel free to connect to each other directly and make this time your own. And I want to thank, we can go to the next slide, and just thank those of our incredible partners, foundations, donors who worked with us over this past year, to Power Good, who supported OCCF's work to respond and meet the needs of our community. You can go to the next as well. We have a couple folks with us today. I don't know if they can't see if they've signed on yet, but Kate Duchesne with RGP and Jack Scholerman from the Scholerman Foundation are expected to be with us today. And also Dr. Maria Mignon, who's joined our board, is going to be with us today. And so thankful for our board and our partners' leadership and support. So, okay, we're going to do something fun. At least I hope it'll be fun, because I don't have to do it, but we've all had some fun with these Zoom polls, right? So before we get into our super meaty important content, we wanted to ask a couple of questions. The first question is going to be, what has inspired you the most about how the Orange County community has risen in this moment of challenge? And then secondly, we're going to ask, what area of need are you most concerned about going forward? And then kind of a fun final question about what you're going to miss when we actually do go back to being more in person. So if you go ahead and click on, now see, I have a poll, but I don't know, maybe I'm not allowed to. Are other people able to respond to the poll? You're nodding. Okay, I'm just not allowed to do it. Okay, that's all right. No one needs, everyone's going to hear me talk about plenty. So everybody, the poll is working. Okay, great. Good to know. And I'm assuming someone smarter than me will know when it's done, or will decide for it to be done. Okay. Poll people, do we have responses? Rebecca, can someone? Can someone who's in charge of this, I am not in charge of the poll. Your moderator is asking for help. Okay, Rebecca, Rachel, Quinn is someone who's responsible. Oh,
yeah, I think we're still getting some answers coming in, so we're just gonna give them a little time.
Okay, so does everybody see the results that I do? Okay, very good. Thank you. Thank you. Okay, wow, collaborative funding and grant making efforts. That's where I would have put my answer. Areas of need, pretty well balanced. Wow, a lot on mental health. Wow, you guys are on top of things. Okay, and people are going to really miss not having to commute or deal with traffic. I'm firmly in the PJ Bottoms camp, so. Okay, so let's move into our program. Sometimes I had a colleague, a community foundation colleague once, who described the DNA of community foundations as being one strand being our service to our community and the other strand being our partnership with the local donors, philanthropists in our communities. And I've always loved that imagery because they're inextricably linked in our work together, and we are continuously looking to be that bridge between people who have passion and the ability to invest in our communities and to help them do that by connecting with the nonprofit organizations that are leading the best and brightest work in our community. And that certainly has been in very full display over the past year. So that's what we're going to spend our time on today. And our group today is also reflective of the two strands of that DNA. We have community leaders, we have donors and foundation partners. So we've got all sides of the equation together today. And so with that, I'm going to hand the virtual baton over to my colleague, Kathleen Otero, who many of you know is our Vice President of Donor Relations and Programs, just celebrated her 7th anniversary at OCCF. And every day is just finding a new way for us to make impact. So Kathleen, over to you.
Great, thank you, Shelley. And good afternoon, everyone. This pandemic, from economic fallout and job losses to food insecurity and homelessness, this pandemic has tested our world, our country, and our community in ways unseen in more than a century. We're so grateful for everyone who's joining us today for this conversation to hear from our community leaders about the experiences that they are witnessing on the ground and a vision for what we as philanthropy can do moving forward. Because we know and we have seen that through it all, Orange County has risen to the challenge. Nonprofits moved critical services online, and individuals and businesses gave generously to help our most vulnerable neighbors. A collective effort between the Orange County Community Foundation, Charitable Ventures, St. Joseph Community Partnership Fund, and OC Grantmakers rapidly deployed nearly $4.8 million to 180 nonprofit organizations in Orange County, serving on the front lines of need through the Orange County Community Resilience Fund. Funds were awarded to homeless providers, food distribution, education providers, mental health and physical health services, and so many more to help our community survive. We learned a lot about our community, gaps in our safety net services, and the ability of our nonprofits to respond. We learned that job losses and economic slowdowns have had a greater impact on lower income families, communities of color, and immigrants. And that COVID-19 itself has had a disproportionate effect on people of color and low-income households. In Orange County, while only 35% of the county population is Hispanic Latino, this community represented 56% of cases. In response, the Resilience Fund awarded grants to 22 community clinics and 19 health-focused nonprofits to help them navigate the growing demand for services. During this time, we were faced with significant challenges to the physical and mental health of our community. Residents have delayed preventative services due to cost, availability, or concerns about exposure to COVID-19. And mental health is becoming a growing concern as stress, anxiety, and depression build. Through all of these challenges, we saw nonprofits responding with a positive spirit of innovation, reconfiguring programs and services to remote delivery when possible, or instituting social distancing and safety measures for in-person services. In fact, 75% of organizations offered services online during this time, and 48% reported increasing the amount of services they provided. Now, what can we do moving forward? In August of last year, the OC Community Resilience Fund commissioned an impact evaluation to understand just that. We surveyed nonprofits, interviewed community leaders, considered economic data and news sources, and reviewed grant applications to compile recommendations for what philanthropy might do to mitigate the damage from COVID in both the near and the long term. The findings were broad and are available on the OC Community Resilience Fund website. But to highlight a few key elements, we know that the findings showed us that we need to recognize the universal impact of COVID-19, but certainly prioritize those communities that have fewer resources to respond. We need to identify and strengthen those critical smaller organizations that continue to be in danger of massive cuts or closure. We need to ensure that safety net organizations and mental health providers have the resources to address the continued increases in demand, even as we enter into a recovery mode. We need to address the important role that schools, youth programming, and early childhood education have, not only on childhood development, but on allowing parents to work and the economy to function. We also need to encourage specialized funding opportunities to focus on important sectors like arts and culture. And last, but certainly not least, our continued focus on collaboration between organizations to avoid duplication of services and to realize operational efficiencies, which are important now more than ever. And now, to go deeper into what we have learned over the past year and the strategies and steps needed for a long-term recovery that is equitable and sustainable, it is my great privilege to introduce our panel for today. First, Yosefa Alofituli. Yosefa is the executive director and co-founder of Cielo, a grassroots organization that empowers hardworking Orange County residents to pursue economic self-sufficiency. Each year, they help equip 1,000 primarily low-income individuals with the tools they need to grow their careers or launch small businesses. Yosefa provides an inside look at the role small businesses and entrepreneurship can play in rebuilding an equitable economy. Next, Ellen Ahn. Ellen serves as the executive director of Korean Community Services, which works to assist and empower Korean American individuals, families, and the greater immigrant community. Ellen will give us an inside look at the healthcare implications of the pandemic and how we can strengthen community health moving forward. And finally, Nancy Mejia, the Chief Program Officer at Latino Health Access, an organization that partners with communities to bring health, equity, and sustainable change through education, services, consciousness raising, and civic participation. Nancy understands the importance of holistic wraparound services for vulnerable communities most impacted by the pandemic. Yosefa, Ellen, and Nancy all have firsthand frontline experience of serving our community, especially some of the hardest hit and most vulnerable throughout the pandemic. Today, they will share what they saw, what they learned, and what a sustainable path forward might look like. Thank you, Yosefa, Ellen, and Nancy for joining us today. So for everyone else in our audience, I wanted to share with you that this is going to be a panel conversation. So I have a set of questions that I'm going to ask our panelists, and I'll start with the first question and kind of go one by one. But really what we're looking for is a little bit of an interchange and dialogue. So I want to invite our panelists, feel free to unmute yourselves, add to what each other has to say? Because I know that as we begin to hear from you and your experiences and what you've seen on the ground, that there will be themes that resonate, commonalities among the communities that you serve, and opportunities for us as a philanthropy and as a nonprofit community to begin to envision how we can move forward together. So I'm going to start with Nancy. Nancy, will you share with us, how would you describe the current state of the community that you serve?
Hi, everyone. Hi, Kathleen. Thank you for the introduction. And, I first want to applaud all of you and all of us for taking the time to have this conversation. A lot of us have been on sort of emergency response mode and have not, had the chance to really stop and talk about what just happened, right? In the last year, we're constantly talking about how do we need to shift and adapt to the pandemic. But I think it's really important that we stop and really heal and work together to look at, what comes next. And so I wanted to share with you, and I'm here representing, like Kathleen said, Latino Health Access. We have been working with the Latino Health Equity Initiative for the last year on emergency response. And through our work, we have employed promotores, or community health workers, that are on the ground. So these are folks that live in the most impacted communities in Orange County. And have been able to work as community health workers doing outreach, education, attending a call center, bilingual call center, helping people really connect to services they need during this time. And we've also been advocating for eviction moratoriums and making sure that people can have testing and the vaccine in their neighborhoods. So what we're seeing now is a community that is resilient, a community that from the start said, we're here, what do we need to do? We had promotores tell us from the beginning, we don't have the privilege to close our doors and stop working. We need to find different ways. So I do want to highlight that a big part of what we're seeing is that we have developed sort of and cultivated a workforce that is rooted in community, and that we would like to continue to build on that. In terms of services and the current state of the families that we're serving, we're seeing families that have lost jobs. We have seen a lot of grief and loss in our community. As Kathleen said, the Latinx community has been highly impacted during this pandemic. And we see a concentration in low-income neighborhoods, right? Especially Santana and Anaheim and other places throughout the county. So we have seen neighborhoods that have faced a lot of loss. And when I say loss, it's of family members, community members, parents, teachers, kids, and at the same time, loss of employment, loss of housing, loss of a future, right, that people had planned for. So we are seeing families that have been impacted economically, also in terms of physical and mental health. We're very concerned about our folks that have chronic disease. The last year has been really hard for them, or also for kids, right, that are at risk of developing chronic disease, because we've all had to shelter in place. We have been less physically active. Our social health, we're also seeing sort of this lack of, because of physical distancing and people having to be away from each other, the social networks that we would tap into for emotional support and other types of support has also been impacted. So we see more folks isolated. We have seen also the impacts of housing injustice, right? The lack of affordable housing was already a problem before in Orange County. And we are seeing a huge need, folks that have accumulated debt over the last year because they have not been able to pay their rent. And the eviction moratoriums, keep getting pushed back, but folks are still not able to pay. So the rental assistance has been helping, but we are very worried about looming evictions when those run out. So we are seeing a community that has been highly impacted in all of the determinants, that were mentioned. And I think these conversations are important. So I want to leave it there because I want to leave time for the other panelists to also share.
Thank you, Nancy, and appreciate the reflection on grounding this in loss and community trauma, and yet the opportunity that we have with a workforce that has fully engaged in the community over this time. Ellen, I want to turn to you from your perspective as a healthcare clinic, as well as your grounded role with the API community. Can you share with us, what are you seeing as the current state of your community?
Yeah, first of all, thank you. Thank you, everybody. I actually wear 3 hats here that may be helpful to the conversation. One is my organization, Korean Community Services, is a on-the-ground CBO, but also a federally qualified health center, one of the larger Asian health centers. I am also the leader of the Asian Pacific Islander COVID Response Task Force. Post-July, it will transition to Marianne Fu, whom many of you may know with Okapica. We share leadership and we do collective leadership, but as of today, I'm the formal leader. And so wearing all those hats, we in the Asian Pacific Islander and API healthcare community have really been fighting dual traumas the last year. The first is we knew back in early 2020 that things will not look good for our community. We heard comments about China flu, Kung flu, and we saw hate crimes starting. And the whole year has been filled with story upon story, nearly 7,000 now across the nation, and our county was not immune. And we responded to those individual families, and our organizations, of course, are gearing up to provide bystander training and beefing up the reporting. And we just realized there was no system in place to address the API hate sentiment among certain individuals. But overall, as of today, many of the Asian Pacific Islander, many leaders in our community, and I'm just one, I think we have all felt a little unheard and invisible. And we are having some very deep and meaningful conversations about how the narrative can change a little, because Asian Pacific Islanders do make up nearly a quarter of our county demographically. But the additional trauma was the trauma facing all of our communities, which is, of course, COVID-19. These are interrelated issues. And so very early on, the API community organized under LOVE, which is Loving Our Vulnerable and Elderly, where we realized many of the food responses were not culturally appropriate. And food is so important to the comfort that's provided at home. And so we mobilized with soy sauce and rice and things that are important in Asian families, mobilized donations. We received many donations because of the generosity of the private businesses and philanthropy. And it distributed a lot of food. But more importantly, we mobilized around COVID-19 under the API task force. And we responded with mobile testing, of course, with outreach and education and in-language materials. And now it's much better, but early on, it was very hard to find in-language materials about COVID-19 prevention. And overall, we've moved mountains, lots of patient navigation, 10,000 tested. These are all limited English speaking, almost all monolingual folks who were facing multiple barriers to testing, and about 10,000. Actually, altogether, I would say tens of thousands of vaccinations. I don't have the exact number, but many of us were working on many fronts and trying to collaborate. But we also realized and learned a lot in that our community is extremely diverse, and the importance of collaboration and also the pitfalls of collaboration were some of the lessons learned. So many of you may know my fellow leaders, Marianne Fu, Tricia Nguyen at Southland, Vitana Pong at Cambodian Family. We are having a lot of discussions right now on how to do this correctly as a collaborative of community-based organizations. Given that resources have been scarce, there is a scarcity mindset in some leaders. How do we do this right so we can move the needle? And they are ongoing conversations even as of today. And we also learned that the data does not serve our community very well. Overall, COVID-19, the data is looking good for the Asian American community. Our vaccination rates are pretty high. Our positivity rates were relatively low. But when you start to disaggregate, and that is the difficulty in the Asian community, the disaggregation. We sensed and we knew, but this data is not easy to come by, that certain members of our community, the Tagalog-speaking healthcare community, the Pacific Islander community, our lowest income communities, we knew that COVID was disproportionately impacting them, and the early data we see is not looking good for those sectors of our community. But in the aggregate, our COVID-19 is not showing the disproportionality, and so sometimes we again feel unheard or invisible. Those segments, those smaller segments. So that's where we're at with the API community and the clinic community. Oh, one last. I apologize before I give some time to Yosefa. As an FQHC, Isabel Becerra from the coalition is much better at enunciating this, but as a member of the Coalition of Community Health Centers, the clinics, my fellow clinics, were the first to respond, mobilizing with testing and vaccinations. We, by our very nature, belong in the zip codes that were the most impacted, and rolled up our sleeves to do whatever we can. And as a group, we've just moved mountains around these healthcare issues around COVID-19.
Thank you, Ellen, and appreciate the reflections on the layered experiences of trauma in the context of increase in hate incidents. And yet I hear the theme of we're coming together as a coalition to be visible and to uplift how diverse of a community our API residents are across the region. Yosefa, you have a little bit of a different perspective to offer, from your small business lens and supporting entrepreneurship. Share with us a little bit about what you've seen on the ground.
Sure. I'll first validate and thank Ellen for her work as a member of the Pacific Islander community, and having seen and experienced the attack that it's had, COVID's had on our community and close family members. So thank you, Ellen. And thank you, Orange County Community Foundation, for this platform. And thank you for those participating who are interested and curious in deepening your knowledge and understanding. So I want to make the point that our community was already in crisis prior to this crisis. If we think about economically, a family of 4 that required at least 3 minimum wage jobs to make basic ends meet, and you layer on top of that the closures of schools and work and our community and our economy, it just it compounded the issues that the 3 of us have been working with our community to address. And for our small businesses, and I want to sort of right size our concept of small business. I think in some definitions, it's businesses that have less than 500 employees or less than $7 million in annual revenue. And in this particular segment, I'm talking about where 95% of our small businesses in Orange County are 10 employees or less. Micro enterprises are considered five employees or less, and annual revenue of less than $250,000 or $250,000. And that's the segment that CLO is focused on. Entrepreneurship has long been a proven pathway for economic mobility for these Black and Brown communities. And the opportunity to sort of formalize these businesses that are very much those in our neighborhoods, right? The tamale maker, the landscaper, the cleaning business, right? These are lifestyle businesses. These are service-based businesses. These are not the businesses that PPP was created for, that the EIDL was created for, or that many of these grant programs are created for. And so what we saw, and when I say we, obviously Cielo, but all organizations serving these types of businesses saw, was an inundation of calls and sense of urgency, primarily around capital first, right? They were bleeding from their cash flow. And as we think about this segment of the population, we don't have this big rainy day savings a pool of money that we can exercise, right? They were already strained with very little wealth built, not to mention savings. And so the capital issue was one that I think was floated around a lot in terms of solutions. But as you saw, particularly during that first round of PPP, the LA Lakers got a loan. And so that's not what that program was built for, nor many of the programs that are focused on small businesses. And the gap is even wider for our Black, brown entrepreneurs, lower income entrepreneurs, immigrant entrepreneurs, and women entrepreneurs. If we think about, we can't think of these entrepreneurs in a vacuum, right? They live in these communities that Ellen and Nancy serve as well, right? They have kids that are in school and health needs and public safety issues. And so when we were forced to go home, this took away the second homes that really helped to raise these families, right? The libraries, the schools, the churches, right? So we have all these folks, average of 7 people per household stacked on top of each other, and they don't have the luxury of choosing between childcare or work, right? It was childcare or work, and certainly most folks had to choose towards childcare. And so what we saw, just to round out my initial comments here, is that a lot of folks were who were wage workers, right, working multiple jobs. As those hours were declining or completely shut off, people were looking for alternative of avenues for revenue or for income. And so a lot of folks turned to entrepreneurship. They might sell something on the side, and they had to make that their full-time gig. Whereas others, because they depleted their savings, they're looking to subsidize their current job. Maybe they still kept their job, but they're needing to find a secondary stream of income to subsidize maybe some of the hours lost or some of the benefits lost. And so bottom line is the crisis was already there, and it's even more compounded now. And so we've got our work cut out for us.
Yosef, I'm going to actually have you continue on with the next question, and I'll go back down the line in reverse order this time, because I think you're sort of leading into the answer to the next question is, what do you see as the long-term potential consequences in the community that you serve? Yeah,
so I'll start by thinking about the ecosystem. And I know that's a trigger word for some, but the ecosystem for entrepreneurship exists in Orange County, and it in some ways it's very vibrant. But if you are someone of color, if you're a sole proprietor or micro business, and you're not focused on high growth, high tech businesses that are going to feed your shareholders, then that ecosystem barely exists. And so that's where Cielo comes into play in providing the wraparound support for those entrepreneurs that are looking to create a stream of income for themselves and for their family. And so long term, we need to help build. Cielo at the center needs to help to construct and facilitate an ecosystem where these types of businesses have access to capital, have access to bookkeeping, have access to legal supports, right? One of the biggest, right after capital, when people, in terms of highest requested need, was after capital, it was bookkeeping. And it was largely because these informal businesses aren't using, our software that exists for many of our small business owners. And so when it came to applying for this grant or that loan, if you look at their books, they weren't prepared, right? So they had a need to help clean up those books. So, creating an ecosystem where we have the different types of support resources available. And one of the biggest challenges that face this segment of the entrepreneurship system is the digital divide. Within these communities, the digital divide has long been a challenge around education, right? In terms of engaging with your teacher, with health, with FQHCs and other groups, in terms of connecting our families to those resources. But it's also now around entrepreneurship. MasterCard, a lot of national players within this space are launching amazing resources through digital platform. So the future of this entrepreneurship game is digital education, right? And so we ourselves are creating a digital platform so that folks can go to it and navigate themselves around so that they can find the answers that they need. But the problem is that, our community doesn't use their devices, their technology for those purposes. Once we're able to help unpack that and create an on-ramp to these platforms, it's going to open up a whole world for them, not just around entrepreneurship, but public safety, education, health, and the whole system. So so we need to focus on the digital divide, and we need to work on enhancing the ecosystem for these types of entrepreneurs.
Great, thank you, Yosefa. And Ellen, from your multiple hats as a community or executive director, as a API community leader, as a healthcare institution, what do you see as the potential long-term consequences?
Before I chime in, it's kind of nice being second or in the middle because you get the same slot either way. A couple points. Long term, the leaders in the API community, I am but one, we are having discussions around the following issues. One is, how do we do coalition and power building, given what we experienced with the Asian hate incidents, and how difficult our public health systems had in responding to the unique needs of our Asian Pacific Islander communities. And how diverse we are. We're having lots of conversations long-term on how do we do this right? How do we support and come together collaboratively and ensure that they are true collaborations as opposed to just lip service to collaborative efforts. We are also having some serious discussions around capacity building. COVID hit all of our multiple nonprofits. Almost all of us are very small. It hit us hard and we weren't ready. We did the best we can do, and we have lots of victories to celebrate. We were little engines that could, but we have barriers that we've discovered, social determinants of health that are just not addressed at all in the Asian community that, we could see were barriers to treating those who tested positive, and many, many Asians did test positive. So what is the capacity building that needs to happen? Those are some good discussions that are happening among the many leaders that I am representing here today. I touched on data, but there are other data questions that we have that the systems are not providing. We do know in the middle of the pandemic that our positivity rates were in line with the general population, but our case fatality rates were much higher than many communities, and that tells us there was a delay in care, that the positive, that those who were really positive they weren't showing up for testing, so we weren't counting them, and the ones who were the ones who did eventually become hospitalized and died. So we want to know why those numbers are looking that way, and what are the case fatality rates. So there's a lot of dissecting in data that needs to be done in our communities. And then I want to touch a little bit about mental health. It was mentioned in the survey, but we are seeing a lot of trauma in our communities. And mental health is one of these healthcare services that really need to be culturally and linguistically competent. It is a disease or a condition that is diagnosed through language, and it is affected by families and cultures and upbringings. And so we don't really have a solid Asian community system of mental health care. And that is some of the capacity building we will be needing to do in the long term.
Great, thank you, Ellen. And I want to acknowledge that we have just a couple of minutes left. So Nancy, I'm going to ask you to respond to sort of the long-term consequences, but what does that really mean for the kinds of services and supports that are going to be needed, and what the role of philanthropy is?
Sure, thank you. See, it's not enough time. Next time we need 2 hours. But so I'll say that we collect our own data also at LHA of the services that we provide. And in the last year, we've noticed that the 3 common reasons people were requesting services were for food, financial assistance, and mental health. In past years, we had seen more around emotional wellness, mental health, chronic disease. So we've seen a shift, and we expect that in the next 18 to 24 months, we're going to continue to see a spike in mental health needs. So we are seeing, we're really worried about safety net, right? The safety net, continuing to sustain safety net for folks, continuing the cash assistance. We're worried about housing insecurity. The things that I mentioned earlier, in terms of where we go from here, we really need to look at a community-driven approach, right? What are the community-driven strategies and solutions? To Ellen's point as well, I think our organizations can't do this alone. And I think our years of being in the community put us in a place where we were in a better place per se to respond, right? To folks in the neighborhoods when we couldn't have them come to our offices and our buildings. So that includes safety net programs. How do we address the immediate short-term needs of folks? How do we continue health education services now more than ever? How do we go back to the neighborhoods and activate streets and places where we don't have parks for kids to exercise, to be physically active? How do we do that safely again? At the same time, we need long-term solutions where we can look at, and I completely agree with Josefa. This pandemic revealed the inequities that we have been, trying to address for years. And this only worsened it. And so it's, how can we take this as a lesson that we don't have time to waste, and that we need to do both, right? We need to address now, and we need to anticipate what are the root causes. How can we build more housing that is affordable? How can we improve access to healthcare services for people that currently are not covered, right? And I know the situation worsened even for folks that do have access to health insurance. In terms of employment as well, we're seeing that, a lot of people had to go home to be with their kids. And now we're a year into this, and there are people that still haven't been able to go back to work. So even now we're starting to see that there are more opportunities for jobs, but there are a lot of, because of culturally in the Latinx community, women tend to be the ones that take care of the kids. So this is also impacting women more in that sense. In terms of our youth, we need to, have more of a presence, we're really worried about the achievement gap, right? How is this going to affect kids who already had to struggle with lower rates of high school education, that we're already dealing with an education gap. So these are all the things that we're interested in working with philanthropy and continuing to work with our partners. And I would say, let's have more of these listening sessions. I think it's important to hear, and also invite next time folks that are working directly with families and providing services, and continuing to build this infrastructure. A lot of us tapped into these infrastructures we've been building with community clinics, with the school districts, and we have created an infrastructure throughout the county to respond. And our concern is that we need to sustain that, right? And now as we're kind of moving into our recovery phase, we don't want that to collapse. We need that to be sustained and also work on disaster emergency preparedness in the long run so that we are more prepared next time. So I'll leave it at that.
Great, thank you all. Just appreciate the parallel reflections too of sort of building the bridge as we cross it. We're entering into this bridge phase between the pandemic and what we hope to be a recovery mode, and how do we do both at the same time? Recognize the current continuing urgent needs while also being forward thinking and long-term and proactive in our planning. I want to take this moment to just thank our panelists for sharing their knowledge and insights. And feel free to put any questions in the chat, and we're happy to provide responses and follow up. But at this time, I'd like to introduce and turn it over to OCCF Vice President of our Center for Engaged Philanthropy, Todd Hansen, who will share examples of how our donor community has responded during this time.
Thank you, Kathleen, and thanks everybody for this wonderful presentation. It really highlights kind of what we've been doing the last year, is having these conversations, because all the engaged philanthropists I work with here are asking the same questions: is how can they be most effective with their giving? And it's been a learning experience for all of us. We've learned a lot, where the gaps are, where we can do it. And I want to share a couple of examples of how philanthropists came together and what that difference made. So I want to bring up the slide there. So as Kathleen started, we did the Resilience Fund. A lot of money was raised. A lot of money went out very quickly. But we also didn't know at that time how long this would go on. And it's gone on much longer than anyone, had ever thought. And so one of the philanthropists that I support said, he gave money to the Resilience Fund, but he said, I'm going to hold some back because I don't know where this is going to go. So he held back funds, and he contacted us in January and said, OCCF, where are the gaps still? I know that there's still needs for food, and this came up with almost all the panelists here. That's one of the most effective ways to help people struggling, is through access to food. And so he said, I'm going to put up some funds here. It was about $50,000. Can you get some other people to join with me? And let's find those small food distribution programs out there that are out there each week providing the food in the neighborhoods, that we don't necessarily know about, but are on the front, lines. And let's offer them some grant funds. And that's what we did. So we invited some other philanthropists to partner in, did some collaborative funding. And the survey, at the very beginning of this program, I think that was the top check mark. What you liked was collaborative funding. And we're seeing that continue to happen in many ways, because none of us can do this on our own. And for these small programs, we actually reached out to Second Harvest and Community Action Partnership. We asked them, who are the organizations that you're working with that really could use some help in continuing to get the food out there? And so we got a good list. We contacted them, and most of them started crying because they're volunteer-only small staffs. And for someone to reach out and say, hey, we have some funding for you, doesn't happen often. And so they submitted these requests, and we were able to get out grants of around $10,000 to a number of organizations. And what they used the money for was to buy a forklift, to fix the refrigerator. Some of them used it to buy food also, but it was to cover those other costs that are hard to cover when you're a small organization that's primarily volunteer driven. And this was a big success. And the number of people that now got more food, it would help them out, in recovery. We can't even count the number. It's so important. But we know it worked well. We got some great videos of how it went. So that's one example of how philanthropy really stepped in a creative way to get the help where it was needed most. And I'm going to give you just two other quick ones. You want to go to the next slide? So the picture you see there says, since you can't come to us, there's a nonprofit in Fullerton called Terrace Chance that does horse therapy. And many of their clients are very medically fragile. So it just, even with a mask on, did not make sense for them to go out and participate in the program. So several of our donors here gave some funding to them. And what they did is they put the horses on a trailer and went out and met their clients where they lived. And, you know, I'll probably start crying talking about how amazing it was, just the joy on their face to engage with the horse. Their parents were so happy because they've been at home with their child with nowhere to go for so long. So to have someone come out to them and do that for a very modest grant, these are modest grants, was really how, you know, philanthropy can show up and just change lives in so many different ways. So I'm going to conclude with kind of where we're at now. We're still talking to a lot of nonprofits each day. And as we all know, you know, we're getting into these better tiers and we're able to start doing more. And so that means there's going to be a big transition back to in-person programming. And so the nonprofits are telling us that, yeah, just for you philanthropists, just be open to what we might need for that reopening. They've done such a good job going to virtual. And what we've heard is many of them are going to continue some modified version of virtual because sometimes they can serve people easier who don't have to have the transportation. So there's a lot of transition happening. And as a foundation, the more we can be open to very flexible grants, the more we're going to help get out of this pandemic and get back to seeing each other in person and really picking up where we left off and making this community better for all of us. So that concludes my fun stories. I'm happy to turn things back over to Shelley Haas.
Thank you so much. And all of you, my gosh, I share Nancy's thoughts that we really could just spend all afternoon digging into these issues. And certainly, if anyone who's participating today has a desire to dig in further on any of these topics, we'd welcome you to let us know. Send any of us an email, throw it in the chat, and we'll capture it. If there was anything you heard today from any of our speakers or any of the sharing you'd like to know more about, this is what we love doing more than anything, which is bringing people together that have shared interests, that have a shared heart for our community, and helping you make the impact that you are envisioning, and for our community leaders to share your work with folks that you might not have the opportunity to see every day. Building that bridge of understanding and deepening all of our knowledge and awareness is very core to our mission. And so please give us a shout if there's more that you want and that we can do. A couple things I just want to wrap us up with that really impacted me from our panel's conversation. It was mirrored by Todd's sharing. And I will tell you that really rarely a week goes by that Todd does not become overwhelmed with emotion. He wears it proudly, and I think it is a great strength of his heart and his gift to our community that he wears his heart on his sleeve in his work. So that's okay, Todd. You always can cry with us because we appreciate that. And so, three things that really I'm taking away from the panel. Yosefa, you talked about how different our needs for infrastructure are in Orange County. And I want to shine the light on that because, and Ellen talked a lot about the need to disaggregate data to pull things apart and really understand. And Orange County, we all know, right? Because we're from here, this is our hometown. The Orange County that we all know and live in is very different than the Orange County that many people see from the outside. And frankly, that's easy to miss if you don't really go looking for the real story. And so really understanding what are our infrastructure needs? Where do we need to build in very specific, and that was compelling, Yosefa, about what small business looks like in Orange County is not what others would define perhaps as small business elsewhere. Ellen, I love your LOVE acronym. I have a book in me that I'll probably always be too busy working to write, but called Leading with Love. But now I'm going to borrow and adapt your acronym a little bit. because what we all do is lift our vulnerable every day. So that is gonna, I'm appreciating your acronym about loving our vulnerable and elderly. And I couldn't help but think of that work. To me, that is the work of love that we do together every day. And then Nancy, you talked about the importance of sustaining the infrastructure. Let's not lose, right? That whole idea of, you know, I'm forgetting the Chinese symbol that is crisis is opportunity and whatever. I totally screwed that up, but someone smarter than me knows what that is, right? So let's not let this opportunity, this crisis, right, that brought us these opportunities. We've had the investments of the past year of our learning, of our blood, sweat, and tears, the things that we built together in the community. Let's not let that go to waste. Let's not let that atrophy because the moment of crisis or perceived public awareness of crisis is over. How do we keep building on that so that we're ready for whatever the next disaster, crisis, sort of body blow that comes to our community, which it will in some different form? How are we more ready in the future? And I can't think of anything better that philanthropy can do than to help us launch forward from where we are right now, all the ways that our communities and those who serve our communities have been resilient and have invented new capacity in this time of want and need. And how do we continue to advance that? So I certainly don't know all the answers. Ellen, as you said so graciously many times, we are one among many community leaders and those that are looking to try to be part of growing the good for our community. Oh, Ellen, Ellen answered my very fumbling. A crisis is a combination of the two characters, danger and opportunity. Thank you. I forgot the danger part. Thank you. This has felt like a very danger-filled time, but I'm so proud. Thank you to our panelists. Thank you to my team, to Todd, to Kathleen for all you shared about our efforts to the Resilience Fund, and to our panelists who shared your time, your expertise with us. And we are so grateful to have been your community foundation during this time. It certainly has not been for the faint of heart for any of us, but we are so grateful to all of the hundreds and hundreds of donors and partners that have stepped up during this time, who continue, as Todd just shared, continue to step up and say, what more can we do? What more is needed? And we will continue to be a bridge from our community to those who are reaching out to help. And we thank you all so much for being with us today. Keep talking to us. Let us know how we can serve you, how we can speak into your needs, whether you're on the DNA strand of philanthropy, whether you're on the DNA strand of our nonprofit community and reaching into those needs. It's our great privilege to be your partners, and wish everybody. And as of right now, Orange County just hit the yellow tier, people. I am a total data. I am on that blueprint. So let's celebrate. Keep getting your shots. If you haven't, take a friend, a neighbor to go get their shot. And I can't wait till we can all be back together and give each other a real hug in real life. Thanks everybody so much.